I did get really curious. I'm kind of an overachiever. And I did get really curious about the admin side of the dental office. I kind of wanted to put my hands in all the pots, if you want to say. And I got really curious about how the front desk, what do we do at the front desk? And I got curious about how does this insurance work? Because, as an assistant, sometimes you're presenting treatment plans and you're talking about financials. So I learned all I could about insurance processing. What does that mean? What do they do? How do they do it? I started asking the questions. And same with patient receivables. Same thing. It's like, well, how can we collect more at the front desk before the patient leaves so we're not doing back end work? So I really transitioned myself into administration because of my curiosity. More or less, I wanted to do something a little bit different. I had the clinical part. I was doing it for a long time. Like I had it, I could jump in, I could do that, but I wanted to challenge myself. So I started there, and the same thing. I worked my way up until I had these amazing systems where I could go into a practice, clean up their AR, and it would be like it was just like a well-oiled machine. We would say, okay, front desk duties, they do this, the back end with insurance, we put these systems in place, and the AR was looking fantastic. And the doctor was happy. We start really honing in. I'm a data person too. So I love numbers, and I love looking at data and charts and percentages, and finding little loopholes here and there. And like the big thing right now that everybody's talking about is what dental insurance companies dropping fees or dropping reimbursements. I think as a community, we could get around that. Let's look at the data. What is the data always tells a story. Numbers don't lie. So creating a good, I want to say, like creating something from the data that you have, you can present to an insurance company, or you can present overall and say how this does not make sense. Tell us how this works. And you can't do that if you're not understanding how the revenue cycle works in the practice, and you don't have the system in place.
Now, did Dynamic Dental Solutions start after COVID, where dental offices are really struggling with finding staff? They don't have the time or the resources to do all the services that you do? Or did you actually start this before COVID?
I started this before COVID. Actually, October of 2018. I started Dynamic Dental Solutions, and I started with just me, where I was helping practices create these systems and maintain them or clean up their AR. And from there, we were referred, or, offices heard about us from Google. We had our website, and from there, our team has grown, mostly from referral from, clients that have been with us since 2018, 2019, and also some trusted colleagues that I work with that know that quality of services we deliver.